so long.
It has. It has.
We've missed you.
I know.
Crystal wasn't here, so I couldn't do a video by myself.
I know.
Because then I would just be talking to myself, and that.
Well, I mean, I did
That's
check
terrible.
a couple times because I was like, I wonder if she's like gonna pull Lindsay or Amy in here.
You know they won't do it.
Well, you could have made them. You are the boss,
I'm not gonna force anyone to video with me.
so I don't have to anymore.
No, you have to. I'll force you to, just not anybody else.
Oh, okay. I see how it is.
Plus, I can't do it without you. What would I do without you?
I don't know.
My partner in crime.
I know. I have no idea. I don't know how you made it through the last 2 weeks.
It was a struggle, man.
The struggle
The
bus.
struggle was real.
Yeah, I was home with my
man.
wonderful
Your
children.
Children. Yeah, I'd rather be at work.
Yeah. I told Dr. Hogan on my way after I dropped him off at the babysitter, I was like, oh, I feel good. No baggage.
You have to carry that sack of potatoes around
I
all the time.
He's over 30 pounds now.
Oh my god.
My 1-year-old is 33 pounds.
That's crazy.
My 6-year-old is 56
Oh
pounds.
man. No, thank you.
No.
I'm good.
He just wanted me to carry him around everywhere when I was
Well,
home
yeah.
for 2 weeks.
Well, yeah. It was awful.
I love them.
So you had a nice vacation.
No, it was not a vacation at all. Plus, for remodeling and there's stuff everywhere.
Mhm.
It was just terrible.
Yeah. Fun. But she's back.
I am.
And I picked out a song that.
You know what? It's really funny. I'm just gonna say this now. My Lincoln,
Mhm.
my 1-year-old,
Yeah.
has a little dog toy that sings this song, and his ears move.
And his ears move?
Yeah.
Man, I wish we had him.
I had no
Today.
idea. I didn't know we
Today.
were doing a video today.
Surprise!
But here I am.
Plus, this intro is great. What's it gonna be? I don't know.
No one knows.
Do your ears hang low? Do they wobble to and fro? Can you tie them in a knot? Can you tie them in a bow? Can you throw them over your shoulder like a continental soldier? Do your ears hang low?
I wish I had you to sing for my child.
If only we charged money for this.
I'm sure our one
We'd
viewer, which
be
is probably Nancy, will.
Returning all of everyone's money.
Mhm.
We're talking about ears today. Yeah. Ears.
How
Oh,
exciting.
we should have figured out how to pull up the ear mite video. Maybe we'll post it in the comments later.
Yeah. Well, how long did it take for them to die?
It was like a week.
I thought they were still alive in a week.
No, well, they were mostly dead. They were 80-90% dead at day 6.
Okay.
So yeah, so we did a super fun experiment. So one of the things, with ears, everyone, not everyone, many people think any kind of ear infection is ear mites. It's not typically the issue unless it's a cat that
Yeah.
goes outside. Or a cat you got from some random place, whatever.
Or like a barn puppy. Sometimes
Yeah,
they'll
sometimes
have
they will, but it's not common. But when we do see them, we love them.
They're fun.
They're so much fun. You can see them crawling around on the slide underneath the microscope. Really creepy.
They're having a great time.
Having a really good time
Mhm.
together. Making some more ear mites.
You went there, huh? You had to go there.
I had to go there. So we'll see if we can. I forget who has the video. I know Brittany took one. I feel like Amy probably did too. But if we can't find it, you could always Google ear mites, I'm sure, and find a really cool video of them crawling around on a slide.
Yeah.
But
they
yeah,
are a
so
lot
we
of
so
fun.
we have these ear mites because this poor little baby, it was a little kitten, it was just loaded. It was awful. And so we took a swab of the ears, put it on a slide, looked at it. Yeah, there's ear mites everywhere. And then because we're weirdos, we got this slide and we were checking it daily to see how long it took for the ear mites to die. And it was about a week, roughly,
Yeah.
give or take. There might have been one or two still alive after a week, but for the most part, everybody was kaput. Yeah.
Gone.
I love it. They gone. So ear mites. So that's how we diagnose those, as we do an ear swab, and we look for them underneath the microscope, and we see little teeny creepy crawly things, and they're a lot of fun.
Mm-hmm. And they're moving everywhere. They're just going crazy.
Mm-hmm.
Yeah.
Yeah. So ear mites are basically little microscopic bugs that live in the ear, and they just crawl around, just like that.
Oh my gosh. Oh, it's getting real in
You
here.
missed me.
I did. Yeah, I missed you a lot.
So let's say it's not ear mites. What else could it be?
Bacteria,
Mm-hmm.
yeast.
Yeast. Mm-hmm.
So cocci, rods, both types of bacteria.
What are cocci and rods? What does that mean, Crystal? What does it all mean?
Well, it means it's a type of bacteria.
Yeah, so
and we
it's
treat them differently.
Yeah, there's just descriptions of the shape of the bacteria, which does give us some kind of clue as to what kind it might be. So cocci means basically just little round bacteria. Rods are rod shaped. And so there's certain medications that we may or may not want to use in different situations. So that would be why we do what's called ear cytology. So we're doing a swab of the ear, put it on a microscope slide, stain it, look at it underneath the microscope, see what your pet has growing there. And that's why we do that.
Because we could put them on a medication.
Sure.
We'll just be like, hey, best guess. Here's what we use.
Yeah.
But if we don't do the ear cytology, that ear medication, there's a decent chance that it may not work.
Yeah.
So now you're spending extra money on an ear medication that's not going to help.
Yep.
And then we're back to square one.
Yeah, like the dog that we saw today that had just tons of rods. Like, yeah, we could have just picked something off the shelf. Guess what? Probably wouldn't have worked. Not against rod bacteria. So,
Yeah.
Which
is what they asked for. One of the medications they requested would not have worked
Would not have
for
Yeah,
the ear.
yeah. So we're not just being difficult or just trying to charge you more. There's reasons for it. And it actually saves you money in the long run because now we know what we're treating instead of just making things up. So that's what an ear cytology is for. So typically when you bring your pet in with an ear infection issue, we'll do an ear cytology. So see, is it mites, is it yeast, is it bacteria? What do we got? Combination of things, who knows?
Mm-hmm.
And then we'll do a good ear cleaning. Why do we do that?
To get all that grossness out of the ears so
Yeah.
the medication will work.
Exactly, because if you put in medication into a dirty ear, it's not going to work as well. And I think we're quite a bit more thorough about ear cleanings than most clients would be. We absolutely can teach you how to do ear cleanings, and I do encourage people to do that at home, but we're going to be far more aggressive about it than what they should be. Because, we're experienced at this and we know what we're looking for and all that. So that's why we like to get you to try to start back, at a good level with no gunk in there or as little gunk in there as we can, so that your medication is then more effective. And two, the one medication that we really like is called Claro. So it is a long-acting ear medication that we put in here. It lasts for 30 days. Again, not effective against everything, unfortunately, but, good for certain situations. But yeah, it needs to be put into a clean, dry ear canal. So that's why we do that. And then you don't clean the ears or do anything with them at home. So that's really nice. So purple hair now, yes. It's purple and blue, actually. Yeah, it's hard to tell.
It's really pretty.
Yeah. I told my hairstylist, I was like, do whatever colors you want, and that's what he picked. So I was like, yeah, works for me.
It's really pretty.
Yeah, and then I washed it for the first time last night, and so much hair dye in my shower. Because that's just what happens. So ear infections, that's the typical gist of what we do. So there's certain times that we may not be able to put any medication in the ear, or we're really limited on what medication we put in there. Why is that?
Because a lot of the ear medications that we use are toxic if the eardrum is not intact, which is why we tell people don't just start using an ear medication because, one, your pet may not have the same type of infection that they had before, which is possible. So you call us up and you say, hey, my dog has another ear infection. It's the exact same as what it was last time because they all present the same way. They're itchy, they smell, they're shaking their head, but it may not be the same thing that's causing the infection. And if you just start with the ear medication we sent you home with before, one, it may not work.
Right.
Two, it could be doing more harm than good because...
So when you say toxic, what does that mean? What will it do? Or what can happen?
A lot of it's like neurologic issues, but they could also lose their hearing permanently.
Yes.
So
it can cause like vertigo type symptoms. So if the eardrum is not intact, and certain medications get into the middle or the inner ear, we can start seeing issues where they have basically vertigo type symptoms. So their head tilt, the eyes moving back and forth. They might be circling, basically balance issues, or hearing loss, either temporary or permanent. So that's not good.
No,
we don't want that. You don't want that.
No good.
No bueno. So Crystal is exactly right. So we want to make sure rather than just, again, we're not trying to be difficult when you call up and say, my dog's got another ear infection. Can I just get a refill of that medication? And we say, no. It's not because we're jerks, I promise you.
Right.
We're not trying to make your animal suffer for longer or anything like that. There's good reason for that. We need to be able to examine that ear, make sure the medication that we're using is the correct one, and that the eardrums are intact. So that we know what we're using is as safe as possible.
Yeah. And sometimes we add in other medications too, depending on how bad the ear is.
Right.
Sometimes we'll do like Apoquel, which is for the itching. It helps with allergies type things.
Yep.
Or sometimes you'll do steroids if they're really swollen or super uncomfortable. It just depends.
Yeah. So there's a lot that goes into it more than just here's the meds. I think it's very different than in human medicine. Back in the day, I had
100 years ago.
150 years ago when I was a child.
She was 20.
I was 22. Or a child. I had ear infections like all the time, like every month. And so, in human medicine, they put you on oral antibiotics. It doesn't work in our patients, unfortunately. It ideally needs to be something topical. Or sometimes we'll do oral medications to be able to hopefully get it better enough that we can use something topical later, but really to beat the whole thing, it needs to be like an ear drop or ointment of some sort. So that's a thing too. We can't just call you in some antibiotics and that'll make it better. Most of the time, really, I would say, what do you think, 75% are yeast infections anyway?
Yeah, typically.
Maybe. Yeah, somewhere in there. So antibiotics aren't going to kill yeast. So even if they could treat an ear infection like that, it's not going to treat yeast. So a yeast is a fungus. So you need an antifungal for that.
And typically, if you're doing the oral medications, it's like steroids to bring the inflammation down so that you're able to see in there to actually treat the infection.
Exactly.
Exactly.
And so that's why we have you come back as well. Typically, if we're doing oral medication of some sort, we usually want to recheck and just see if we're being effective, and see if we can switch them to something stronger. Because there are, unfortunately, a lot of times where I'm like, well, this is all we can do for now. But we're going to see if we can get better to a point where then I can do something stronger to finally kick this infection. Like maybe I don't expect that it's going to be cured with what we're doing on the first round. I just want it to be better to where then we can do the thing that hopefully cures it. So animals that get repeat ear infections, why is that?
A lot of times the dogs that are getting ear infections have the big floppy ears. So labs, Goldens, yeah, Cocker Spaniels.
Ugh.
Yeah. And it's mainly because the moisture is being trapped in their ear. Or a lot of labs like to go swimming. So they go swimming, they get the water down in their ears, now it's trapped in there, and it just starts to fester, for lack of a better word.
That's a great word, fester.
Right?
I love it.
Gross.
Yeah.
But yeah, basically that's what's happening.
So that's,
And then-
that's one of the reasons.
Yeah.
Why else?
Allergies.
Yeah. And unfortunately, all those breeds are also prone to various allergies,
Mhm.
food, environmental, whatever. And sometimes the only allergy symptoms that we see are reoccurring ear infections in one or both ears. It can just be one ear, and it's still there's an underlying allergy that's there. So same thing for cats, not just dogs, also cats. With chronic ear infections, there's probably some kind of allergy situation that's happening that needs to be addressed. So when we have people that come in like, he's gotten another ear infection, it's like, okay, well now let's start talking about, what we can do to try to prevent these, or at least make them less frequent. And then we start talking about allergies and what to do for that. Yeah. So what else? What else can happen with ears? What did I say? Oh, hematomas.
Yeah.
So that kind of goes along with an ear infection. So an ear hematoma or an oral hematoma, AURAL, hematoma, is basically like a big blood clot that happens.
Got this one.
You got this.
I
You
got
did
it.
it, girl.
I got it. Basically what happened,
See what happened was.
actually one of my dogs at home, I feel like this happens all the time. I always have something.
It's because we both have a million animals. So
Yeah.
there's always somebody has something.
I have 4 dogs. One of my dogs actually has an oral hematoma right now. So what happens is they're shaking their head or, whatever, they hit it on something. It breaks these little blood vessels in the ears.
Mhm.
And now it fills up and makes this pocket of fluid. And it's like a little water balloon in their ear.
Yeah.
And it's no fun. And I feel really bad for him because it hurts.
Yeah. Some of them get really big and full and like they're red and they're hot and it's just like, oh, it's gotta be miserable. So a lot of different reasons they can bust open a little blood vessel there, and then that's what happens because where else is the blood gonna go? Just goes between the layers of the ear. So the ear flap basically, it has skin on 2 sides and then cartilage in the center. And so when you get a blood vessel breaking open, it just separates those layers and creates this nice little pocket for blood or a blood clot to be.
Yeah.
So super fun. So with those, there's like a million different treatments for those. When I first started practicing, we did surgery on, I would say, the majority of them. The problem is, number one, it's surgery, so that kind of stinks. So it's, pricing and dealing with that and anesthetic risk and all that. But also, it doesn't necessarily cure it. So we do surgery to basically open up that pocket, empty it out, and then place stitches tacking that layer back down. And hopefully then it sticks and stays, and so then that hematoma doesn't fill back up again. But I did have a patient, I think I had 1 or 2 patients, that for whatever reason it just kept filling back up. So then we started treating them just medically. So doing where we drain the hematoma as much as possible, and then infuse a little bit of steroid in that little pocket. A lot of times we'll also do oral steroids along with that, try to bring down the inflammation and get it to heal on its own. Regardless of which option, I think they kind of always get a little crinkly. So they'll always kind of heal like with a little wrinkled sort of texture to them.
Kind of reminds
like the boxer
me.
cauliflower ear sort of look. Yeah.
Cauliflower ear. That's what I was going to say. That's what
Yeah.
it reminds me of.
So that's something it seems like kind of no matter what is probably going to happen. So if you see a dog with a crinkly ear, that's probably what had happened to them at some point is they had a hematoma. So I usually nowadays I try to treat them medically first and save surgery as kind of a last resort. Because most of them get better that way. Not her dog.
Well, yeah. I mean, how long would you
Because
say
of course not. Of course not. If
How
it's
long would you say it normally takes? Because
a couple months.
I haven't drained it in at least a month.
Yeah.
And his poor ear is so big and puffy, and it, if you touch it, like I'm rubbing his ear and I touch it, and he's like,
oh, poor baby.
But I feel so bad for
Poor
him.
Jason face.
I know.
So he may be getting some kind of additional procedure. We're trying to decide what the next step is that we're going to do. So that's called an oral hematoma, and that's something that we can see either just as a consequence of trauma, so they like smacked their ear on something, or like they were playing too rough, or they've got an ear infection. That's a lot of times what has happened. They have an ear infection and they've been shaking their head, flapping their ears around, and that's why that happened. So, so yeah, hematomas are relatively common as well. What else did I say we were going to talk about? Hearing. I did say hearing.
What about the hearing?
I don't know. How do we test for hearing in our patients? So this is something, unfortunately, we occasionally get. People are like, I think he's lost his hearing. For our
They're
purposes, on a as a general practitioner sort of level, unfortunately, our hearing test is this. Did they respond? And that's really sad because it's not real technical. There are more involved hearing tests that can be done. It's just something that's usually done at like a neurologist's office. It's not something most general practitioners can do. So if there is, I can confirm, yes, they seem like they hear, or no, they seem like they don't hear. But beyond that, I don't know. We can examine the ear and make sure that there's no signs of eardrum issues or anything like stuck in there or clogged in there. But yeah, as far as like a true hearing test. And I don't know that they really make hearing aids for dogs.
Can you do that one more time?
What? To hear that?
Most of the time they're just
Can you hear me now? Yeah, a lot of the old animals, they just have selective hearing, I'm sorry to say. So if they can hear you put food in the bowl, but they don't seem to hear you when they're like outside, it's because they're ignoring you. They've just decided they don't have to listen to you anymore. They know nothing's going to happen to them.
Mm-hmm.
They know.
I have one of those at home
That's
too.
what my jerks do. They're not even old. They're just like, psh, Tom's not going to do anything to us. He's just going to yell for us and look like a fool. Stand on the back deck going, get inside! Come inside! And they just keep on sniffing. Keep on sniffing. Or keep on barking at the neighbors. My dogs are jerks. I love them, but they're jerks.
Mine too. I will say ear injuries bleed like crazy.
Oh, yeah.
Because they're so vascular.
Mm-hmm. Yeah.
So
So really putting some pressure on it is probably about the best thing that you can do. Because too, a lot of them, we don't necessarily stitch them up. We can sometimes, it just depends. But for small little cuts and things, we usually just end up putting some pressure on it and calling it a day. Because as soon as we start trying to suture it, it's just going to bleed. It's going to bleed more.
mm-hmm.
So, yeah, not a lot that we can do there, unfortunately. What else about ears? Anything else exciting you can think of? I think I covered all of my topics.
Yeah, I don't think I have anything.
Okay. So we'll have to see if we can find the ear mite video. Yeah. Yeah. We're so weird.
I was going to say, you're such a weirdo.
Well, I am a weird. I'm a big geeky weirdo. It's fine. I get excited about things. Well, you get excited about like abscesses.
I do.
and
I love
cysts.
abscesses.
See? It's like,
They're my
that's how I
favorite.
feel about that. So.
I mean, it was fun.
Mm-hmm. Yeah. I don't know why. I will always get a thrill of seeing what it's like.
Even after 200 years.
Even after being in veterinary medicine for 400 years. Oh gosh. All right. Well, if anybody has any questions about any of the topics we discussed today, definitely let us know. Otherwise, we'll see you next week. I have no idea what we're going to talk about next week.
You knew I was going to ask.
I
didn't you?
know, but I didn't look at the list to see what our ideas were.
Well,
And
maybe-
anybody that's joining us for pictures with Santa on Friday, I hope you have an appointment.
Yeah.
Because I feel like it's gonna be crazy, and we're gonna do our best to keep things as organized as humanly possible, and get as many people in as possible. So I'm hoping to not have a bunch of disappointed people having to leave, but it may come to that. I don't know. We're gonna do the best we can, guys.
He's
That's all I
only
can say.
here. He's here for 2 hours.
He's here for 2 hours, and we can't keep him any longer than that. So, yeah, we're gonna try to make this as organized as we can. We got a list that we've got planned for checking people in and rotating people through and trying to get people prepped and ready to go. So hopefully all goes the way that it's supposed to go in my
Wow.
brain.
I mean, we filled up fast.
Real fast. Yes.
And
Yeah.
we've got a wait list. So if you're planning to come, I would plan to get here early.
Yeah.
You're
And
probably gonna have
waitlist people
wait.
will be contacting you tomorrow to let you know if you have an appointment slot, and if so, what time that is. We're doing confirmation texts today. So be on the lookout for those and respond and let us know if you're coming. Please, if you are not going to be able to come, please, please, please let us know because we do have a wait list of people that are wanting to get in that we've had to say, well, we'll see.
Yeah.
We'll see. So, yeah. So otherwise, we'll see you guys next week. We'll figure out what the topic is and maybe post something about it. Sometimes it's just fun for it to be a surprise.
Something on me?
What?
You keep looking over here.
I keep looking at your ugly mug.
You know.
And that's not like an insult to your face. I keep looking at your ugly mug over there.
No, okay, I got these. It was a two Shut up. It was a 2-pack. I got them at a garage sale, and I don't know why, but at the time I thought they were really cute. It's like these little frogs. This one looks really sad over here.
I don't know who created those or where they came from.
I wonder if someone painted them.
Well,
Like,
it's
maybe
kind
they
of what
were-
it looks like, and I feel really bad for saying it's ugly, but it's
You know, I at the I mean, they were like 50 cents for 2 coffee mugs, and you know what? Whatever. Just
all right, everybody. We'll see you next week with Crystal's ugly mug. Bye.